Hello, my name is Mike Ackerman, and I'm a genetic cardiologist at the Mayo Clinic in Rochester, Minnesota. I also serve as director of Mayo Clinic's Genetic Heart Rhythm Clinic, the Windland Smith Rice Sudden Death Genomics Laboratory, and the Mayo Clinic Windland Smith Rice Comprehensive Sudden Cardiac Death Program. On behalf of all of our team, thank you for considering or for already choosing Mayo Clinic and Mayo Clinic's Genetic Heart Rhythm Clinic for your care. We can't wait to meet you and to take care of you and your entire family. I trust that your entire Mayo Clinic experience will be nothing less than amazing. If you have not made your appointment yet, you can call the appointment line at 507-284-0101, and there either Erlene or one of her colleagues will be eager to help you. Typically, she'll be working with you to arrange your family's 2 to 3 day initial evaluation if this is your first time to Mayo Clinic. Once you arrive in Rochester, Minnesota, your Mayo Clinic journey will begin usually in the bottom of the Gonda building, where you'll get an electrocardiogram, an ECG. By the way, an ECG and an EKG are the same test. Don't be surprised when you return there the next day to get a second ECG. I almost always order 2 of them. After that, the rest of your tests are tailored to what questions we are striving to answer for you and together with you. Those tests may include some blood work at Desk C in the Hilton building, a treadmill stress test and an echocardiogram back in the Gonda building, appointments and evaluations with other members of the team, and so forth. Generally, your first time to Mayo Clinic will end with a consultation with me or one of my colleagues where we will typically spend anywhere from 1 to 3 hours with you and your family going over everything. Don't be surprised to leave that appointment wearing a 24-hour Holter monitor and wearing it back home. You'll just mail that back to us. When we meet each other for the first time, also don't be surprised if you hear me start our evaluation asking you the following 2 questions. Has everyone taken good care of you and your family so far? Is one of the first questions that I always ask. We expect the answer to be yes from your very first steps onto the Mayo Clinic campus all the way to and through the end of your main consultation with me and my team. We expect that every step of the way, every Mayo Clinic person who comes in contact with you and your family will be a special encounter. Then I'll ask you a second question. I'll ask you, what will you and your family view as success, as mission accomplished with this visit? Your answers to this question help make sure that my team and I are laser focused as to why you chose to take the time and energy to come to Mayo Clinic. I want your Mayo Clinic experience in general and your experience with Mayo Clinic's Genetic Heart Rhythm Clinic to be like nothing you have ever experienced so far, to far, far exceed your expectations. It is my expectation that my team and I will give you our very best. If we conclude that you don't have the life-threatening diagnosis that has been assigned to you and your family, we will tell you why. In fact, over the last 20 years, at least 30% of the patients and families who have arrived to Mayo Clinic with the diagnosis of long QT syndrome, for example, have left Mayo Clinic without that diagnosis. In fact, they've left Mayo Clinic without any important diagnosis. They have been reclassified as normal, having been overdiagnosed or misdiagnosed previously elsewhere. On the other hand, if you do have one of those genetic heart rhythm conditions that increases the risk for sudden cardiac arrest or even sudden cardiac death, we will implement a personalized, tailored treatment program with the ultimate expectation that you and your family will live and thrive despite that diagnosis. So on behalf of Mayo Clinic's Genetic Heart Rhythm Clinic, thank you for giving us the blessed privilege to take care of you and your family. We are looking forward to meeting you. Welcome to the Mayo Clinic family. See you soon.